I'm Candace Lindo Davies, and I am going to be talking to you a little bit about Hands and Voices and our FL3 Center and the virtual work that we've been doing with families. So you can see here our first slide. We're just a big thank you to AmChip for the support that we've had to build out some of the materials that we've developed. And I also was planning to be presenting with Sarah Kennedy, who's also on staff here at Hands and Voices. Unfortunately, she is down for the count at the moment, so I'm going to fly solo today. But we're so happy to be here and have the support of AmChip to talk a little bit more about virtual support for families. So if you wouldn't mind advancing the slide, that'd be great. All right. Like I mentioned, I'm Candace Lindo Davies. I'm the Director of Outreach for Hands and Voices headquarters. There's a family photo from a wedding a couple years back. I am first and foremost the parent of a young man who is deaf and also has some additional health challenges. We lovingly refer to that as deaf, hard of hearing plus. And I'm also the parent of a 23-year-old hearing, typically developing kiddo, and my husband Ron is in that picture too. I would have been joined today by my colleague, Sarah Kennedy, who has a long, illustrious background as well. We both have been leaders of Hands and Voices chapters in our own states. I'm in Minnesota. She is in Colorado and recently just actually handed over the reins to Colorado Hands and Voices to her successor. But she is the parent of a daughter who is deaf. And has been the Hands and Voices communicator newspaper editor for many years, but her title goes well beyond that. She's an amazing advocate for families and provides a lot of technical assistance, grant writing, and various and sundry other things here at Hands and Voices headquarters. So I'm sorry that she's missing us, but I will do my best to honor her presence in her absence. So if you wouldn't mind advancing the slides, that'd be great. All right. I thought I would share a little bit about the connection between Hands and Voices and the FL3 Center, because we do have that name typically in our title when we talk about things. And so Hands and Voices is a parent support organization supporting families for the past 26 years, who have all families who have children who are deaf and hard of hearing. And so that foundation of doing family support led us to then back in 2017 being awarded by HRSA the FL3 or Family Leadership in Language and Learning, or FL3 grant, or cooperative agreement, I should say. And the first several years of that cooperative agreement, we had many different goals that we worked on. Most recently, though, these past several years and going into the future, we have the present goals that I've shared here on the slide. So really it's around providing support to other family-based organizations who do support to families like us who have children who are deaf and hard of hearing. We do try to increase the number of trained parents who can serve in that capacity to help families. We're trying to be a technical resource center about resources around deaf and hard of hearing support services, and then really just trying to grow and sustain collaborative partnerships. So you'll hear a lot about the FL3 and Hands and Voices as I'm talking today. So I just want to make sure that I put the two together for you. Next slide, please. All right, so just a little background on Hands and Voices. Like I said, we've been around for 26 plus years. We also have 45 chapters across the US and other parts of Canada and a few other places, but really all around unbiased support to families. And that's really our cornerstone, is that there are different organizations that maybe specialize in different ways of communication or technology or not using technology or whatever. We try to be very inclusive and kind of comprehensive in the support that we offer, that it really is meant to be that any family with any choice that they've made for their child who is deaf and hard of hearing is certainly welcome within the Hands and Voices community. So unilateral hearing loss, bilateral, meaning both ears, something that happened at birth, something that happened later, all of those families we strive to try to provide support. So I'm going to ask for the next slide, please. As far as where we support, just wanted to kind of give you a little bit of a map here. We've divided up under the FL3 Center, the United States, as far as kind of different regions. And so we provide technical assistance. We have staff that are assigned to those different regions to provide technical assistance. So really around the art and training and involved with providing family support to families with children who are deaf and hard of hearing. And then we also feel very strongly about support through deaf and hard of hearing adults to family. So you'll hear a lot about that in our work. And then, like I mentioned earlier, we're really focused on trying to grow more parent leaders because Hands and Voices headquarters doesn't do a lot of direct support to families. We really rely on our chapters and our other family-based organizations who do that direct support. And so we really want to provide leadership training and technical assistance around how we can share those resources. Oops. All right. This next slide is kind of a refurbished look at how we view parent support at Hands and Voices, and that is that we really have always believed that there's different types and different ways you can provide support to families, and that no one way is the right way. Certainly, there are families that feel most at home and at ease talking to someone one-on-one. And so if that means that they get a call from a trained family support provider that can reach out to them and talk with them over the phone, or maybe that's through email, or maybe it's through Zoom, or whatever it is, if that one-on-one support is how they need it, great, we will do that. If they need to kind of at first, like just watch the things that we're doing kind of go by in front of them. So maybe they want to just be a passive observer to support. Maybe they're going to, read newsletters or follow email blasts or, click on things on YouTube or blogs. Passively receiving information is perfectly fine. And maybe that will lead them to getting more direct support. Certainly another aspect is just anonymous, where they literally don't have to engage with anyone. They don't even have to be in a chat room or a Facebook group or anything like that. They can just kind of be anonymous to what's going on, and that's okay too. Personally, I would ultimately love to see parents come out to some kind of group parent-to-parent support, because I think that's really where a lot of really amazing things can happen, where you can kind of create a bigger orchestrated event where there are perhaps deaf and hard of hearing adults or youth or other professionals, or all these things can happen where there's kind of people meeting up together and having conversations. And I think that's ultimately the goal, to get people there. But if people want to stay in one of those other quadrants of family support, perfectly okay. And so really, I think with COVID and the pandemic, we've seen a lot of this shift and morph. And I think that's really what we're talking about today, is how we've changed from perhaps, the evolution of family support over the years to something more virtual, and what we've learned in the process about the value and the need for those virtual supports, because not everyone fits into one box. So next slide, please. So really, I just wanted to give you a little bit of an overview of some of the things that Hands and Voices has developed. And specifically, the one called the Virtual Waiting Room was something that was developed through AMCHIP funding. So we're so grateful for their support. The virtual waiting room was a concept that we were eager to get into fruition, because we knew that things were changing, that parents were no longer sitting in an actual waiting room. And in that waiting room, they would have the benefit of being able to talk to, say, another parent that was in that same audiology waiting room, waiting for an appointment, or they wouldn't be able to talk to the deaf and hard of hearing adult who was maybe going in to see someone. And so what we wanted to do was create a virtual waiting room where families could perhaps have access to some of those same experiences and some of that same information of getting brochures off of a brochure rack, or watching a video that maybe is in the waiting room lobby, or whatever it might be. And so we created this virtual environment for them. And so in our Hands and Voices virtual waiting room, you can get information about finding out that your child is deaf and hard of hearing, and what are those resources, what are some opportunities to reach out to other families. How would I go about doing that? How do I take care of myself while I'm going through this transition? So we've developed all these tools and resources in that virtual waiting room. And it does have a component where you can actually ask a parent guide and ask questions if you need to. So there is someone to actually connect behind that interface. But it's a virtual room. So you literally click on the icons in the room, and that will lead you to another portal that will get you more information. So that's just one example of a virtual environment that we created, given the fact that we were in a different world now and providing support in a different way. Another example is our parent app, and that's the icon, the image on the right here. And this was something we developed in response to the fact that parents were getting information more often from their phone and from apps. And so we wanted to be responsive to giving information to parents as they were just finding out about their child's identification as being deaf or hard of hearing. And so by downloading this app, either on an Android or Apple phone, boom, families can start getting information about 3 different resources on once a day for 90 days. And so it's meant to be kind of a way to just start kind of trickling in information, a little bit at a time, little wisdom from parents, wisdom from deaf and hard of hearing adults. They get an article to read, and then also some type of website or resource to explore. So just again, another way to reach families in a different method. Next slide, please. Some other examples of ways that parents can get information and implement them in a virtual way. We developed through our FL3 program the language literacy and social development parent tip sheets. And so there are 8 of them. What they are just basically a synthesis of research developed by our scientific advisory board, where parents can dive into a particular topic of language or social development, and then there are tips that they can follow. And it's really meant to be used with an early interventionist, so that the parent can kind of engage with ideas, and that interventionist can help them kind of really apply specific ones that are really pertinent to what's going on with their particular child. We were able to take this and also develop a family activity plan, which I showed in the corner here, where a parent could take these tip sheets and literally plunk them right up on the refrigerator and kind of draw out a plan for how they could incorporate some of these tips into their day-to-day life, make it simple and sweet. Those are also coming out in Spanish as well, so we're excited about that. The image on the right is about our resource called 8 Great Reasons to Say Yes to EI. And that was developed out of a work group in Colorado, actually, where there was a discussion around what are some of the barriers to families not enrolling into early intervention and not taking advantage of some of those precious services that we know as parents to be really, really important by being enrolled. And so it's kind of a Mythbusters, where they're breaking down 8 different reasons why yes would be the reason why you want to enroll your child into early intervention. And what's neat about this resource is that not only has it been translated into Spanish, but it's also been created into different formats too. So if someone wanted to take this and put it into a packet for parents, or they wanted to make it into a banner that they would put at events, there's a lot of different ways to adapt this resource too. So that's just another example. Next slide, please. And then I also wanted to give you an opportunity to see some of the parent leadership skill development sessions that we offer at Hands and Voices in the FL3 Center. And so we talked about some specific supports, but we just wanted to also mention some of the opportunities that we provide for parent leaders to really grow their skills. So I actually host the FL3 office hours, where we have a topic each session, and we invite someone to come in and present on a particular topic. It might be on deaf and hard of hearing adult to family support, or it might be on literacy, like we did just this last week. Then there's a discussion that follows, and it's really not meant to be a direct classroom training as much as a sharing of an exchange of information among parent leaders and family-based organizations. We do also offer our flipped classroom topics for deaf and hard of hearing parent parent leaders who work with deaf and hard of hearing families, I should say. And that's facilitated by my colleague. I think she might be on the call today. And that really is a very intensive kind of classroom setting where they're asked to do some pre-work and then on a particular topic, and then come to the session prepared to really kind of report out and exchange information about the topic. We also host leadership book clubs. Those are a lot of fun. We're going to be doing one actually using children's books as the way to kind of talk about leadership tips. So I'm excited about that one coming up. We have a L2L or Leadership to Leadership program. Molly Martsky actually on the call was very instrumental in getting that program off the ground. So kudos to her for all that work that she put in. And that's really a very year-long intensive program where someone would have to apply to be in the leadership program, and then they would we would create opportunities for them to engage in different webinars, Zoom interactive discussions amongst their peers, as well as having a mentor available to them. So that's a really fun opportunity. We offer our Children's Safety Project. Those are 9 gatherings per year. We talked about the prevention of child abuse or neglect or bullying in those sessions. So it's a pretty heavy topic, but we feel it's very important for our population. We also participate in parent-to-parent community projects. For example, we're working on a fathers project right now. We have a fathers task force convened, and these fathers are going to be giving input to a resource that we're going to be sharing for new fathers. So that's a really fun one too. We also have a Latino community forum where our Latino Council for Hands and Voices facilitates discussions to try to further and advance support to families who are Spanish speaking. And then, like other parent organizations, we also do have Facebook groups for kind of specialized subgroups of our population. We have a Fostering Joy group for families. We have a Fostering Joy group for professionals where we talk about the joys of raising our children who are deaf and hard of hearing. We have a group specifically for families who have children who are deaf and hard of hearing plus other health conditions, like my son I mentioned has other health conditions. So we have a group just for that. We have a military group for families who are in active military duty. And we have a group for families who have children who have one-sided or unilateral hearing loss. So those are just some examples. Next slide, please. And then I thought I would talk a little bit about what our chapters do, because I talked about what headquarters, Hands and Voices headquarters does, but there are also a lot of work that's being done on the chapter level. And so as COVID was hitting, there were already chapters that were doing virtual events, but I think certainly the pandemic amped up the need and the expansion of virtual events for families. And so they were already doing probably one-on-one support to families through programs such as our Guide by Your Side program, where families get assigned someone to kind of walk through their journey as they're just starting out after their child was identified. But then there are also other opportunities to do more group interactive supports. And so our chapters do a really good job with that. One program that we have too is our Educational Advocacy Program, or ASTRA program. And there are a lot of things that are going on because, as you can imagine, with COVID and the pandemic, there's a lot of need for discussion around, so how is this going to impact our child if they're now learning in a virtual environment? And so there's a lot of advocacy work going on. There was also, there's been things like fundraisers that have gone on at our chapter levels, just trying to promote engagement of families, but also for a cause, support some more initiatives they might be doing. There's been a long history of doing Mom's Night Ins, they call them, either a one day or an overnight type of mom's event. And with the pandemic, those had to be reimagined to a virtual environment. So the moms could still get together and they could still do some of the self-care topical discussions, things like that, but they could do it in a virtual environment. Believe it or not, we had chapters converting their in-person camps to virtual camps where they were literally sending out little s'more packages and little camp-like things out to the families. And those were really popular. And I think they really enjoyed it because everyone was just so craving to be together and go to camp, but yet they couldn't. So they tried to recreate something that gave them a little bit of that feeling and kind of spread it out just a little bit longer until the in-person camps could start back up again. And then there was a lot of work being done by our deaf and hard of hearing adults, because we do have a branch of our Hands and Voices programming that has deaf and hard of hearing adults in a trained position. And so there were a lot of activities going on where deaf and hard of hearing adults were leading story times or doing little science experiments or ways to engage the families and really the children, and having those deaf and hard of hearing role models still be in their lives. And like I mentioned, at the headquarters level, there's a lot of activity going on social media. And so that was really wonderful to see that all the Facebook Live events and streaming and chats and things like that could continue around a variety of different topics. The next slide, please. And so I thought I'd just give you a couple examples of some of those chapter events and virtual supports that were going on. The one with the orange background, that's Texas. They did a May Tuesday topic, and this was a great example of infusion of deaf and hard of hearing adults. So you can see that one there. The middle one was Arizona Hands and Voices. They were just going gangbusters and will continue, and a lot of them will continue to do these events virtually too. But their literacy events got so popular that they had a whole offshoot in Spanish, which was really cool. Donated books and the like. And then Illinois just had an example here of their dad's meetup, which is really cool. Again, trying to get to those underserved or unrepresented populations as well. Next slide, please. And then just a sneak peek. Actually, a couple of these are already out. Actually, by the time we turned in our slides, these became available. But Hands and Voices is now on the podcast realm. So we have launched our first season of podcasts on a variety of different topics, from letting go of ego to seasons of leadership, to talk about racism, a frank talk about racism. So please check those out and subscribe. And then we also just are launching our Hands and Voices Online Academy, which includes training, not to supplant or to take away from any training that is already being done for deaf and hard of hearing adult to family support. But this is really just meant as a supplement and an augment to those trainings, getting into some specific areas that we knew would be really helpful. And then also that L2L program I mentioned earlier, that leadership program, we've now launched a Hands and Voices lead course, which is meant to be kind of a do-it-yourself online virtual way to get leadership skills without that intensive leadership mentoring component. That's the one piece that's different with this. And then soon to be launched is going to be a data collection course as well. And that's going to help family-based organizations get into how to collect data, how to review data, and how to see the impact of data, led by one of my colleagues, Vicki Hunting. Next slide, please. And that is really it. Just contact information for myself and for Sarah and for the FL3 and for Hands and Voices. And I think we're going to transition over to discussion. And so if you want to take those down, great, perfect. Hope that was helpful. And if you have any questions, certainly let me know.